This is ChainMind, the decentralized AI network built for everyone. Just search ChainMind on Google, sign up, download the app, and you're in. That's it. You've joined the network. Run it on any device, phone, laptop, or server. Why ChainMind? Fully decentralized, fully yours.
The numbers are in, and they're not just a blip on a spreadsheet, they're a warning siren that most of us have been ignoring. In the past year, the United States slipped from 93.5% to 92.8% in fully immunized children, while exemptions crept up from 2.1% to 2.6%, and nobody bothered to explain what that means for the next outbreak. That stark headline is only the surface of a deeper problem, and it all starts with the data itself. The CDC's latest release is a collection of raw tables, stripped of the visualizations, context, and narrative that have traditionally guided public health decision-making. When you look at the numbers state by state, the story becomes even more unsettling. Texas saw exemption rates climb by 1.2 percentage points, Idaho by a full percent, and both states are already experiencing the steepest drops in measles, mumps, rubella coverage. Meanwhile, a handful of mid-Atlantic states have managed to hold steady, suggesting that local policies and community attitudes can still make a difference. Those raw percentages translate into millions of children who are suddenly more vulnerable to preventable diseases, and they signal a widening gap between public health goals and what's actually happening on the ground. Why does the CDC's minimalist approach matter so much? In past years, the agency paired its data with trend graphs, demographic breakdowns, and clear policy recommendations. That package gave journalists a ready-made story, gave health officials a set of actionable insights, and gave the public a transparent view of where the nation stood. By publishing only the tables, the CDC has effectively handed the narrative over to anyone with a spreadsheet and an agenda. Some analysts will spend hours cleaning and contextualizing the data before they can even start to draw conclusions. Journalists scramble to fill the void, and in the meantime misinformation can spread unchecked, cherry-picking a single figure to sow doubt. For everyday parents trying to make sense of school vaccination requirements, the lack of a clear explanation feels like a deliberate opacity, feeding the very distrust that fuels exemption requests. Transparent, timely, and granular data are the lifeblood of any effective disease prevention strategy. When coverage drops, health departments need to know exactly where the gaps are so they can dispatch mobile clinics, launch targeted education campaigns, or adjust school entry rules. The current CDC release hampers those efforts in three critical ways. First, speed. Analysts must clean, merge, and visualize raw tables before the information becomes usable, turning a process that could be done in minutes into a multi-day ordeal. Second, granularity. Without county-level or even zip code-level breakdowns, officials are forced to guess which neighborhoods are most at risk, leading to inefficient allocation of limited resources. Third, accountability. When the data is presented without a narrative, it becomes harder for lawmakers and the public to hold officials responsible for missed targets or policy failures. In an age where a single false claim can travel faster than a virus, the cost of that opacity is measured not just in missed shots but in lives. But here's the part most people get wrong. The solution isn't simply more bureaucracy or another federal report. The real breakthrough lies in how we process and share the data, and that's where decentralized artificial intelligence enters the picture. Imagine a network where thousands of small computers, running on anything from a school server to a community health clinic's laptop, work together to ingest, clean, and analyze vaccination records the moment they're entered into state registries. That's the promise of a platform like ChainMind. By spreading the computational load across a peer-to-peer mesh, the network can turn raw CDC tables into actionable visualizations within seconds, not days. Privacy by design encryption means that sensitive health information never leaves the node that holds it, dramatically reducing the risk of a central data breach. And because the system isn't dependent on a single server, it remains resilient against outages, cyber attacks, or political interference. A concrete example helps to illustrate the power of that approach. Picture a consortium of health departments, school districts, and nonprofits each running a lightweight chain mind node. As a child's immunization record is entered into a state database, the node automatically extracts the relevant fields, updates the local coverage calculations, and broadcasts an aggregated metric to a public dashboard. Within moments, a county-level heat map appears, showing which neighborhoods have slipped below the 95% herd immunity threshold. If exemption requests in a particular zip code surge by 0.3 percentage points in a single week, the system flags the anomaly and sends an automated alert to the local health officer, who can then dispatch a community liaison to address concerns before an outbreak takes hold. Predictive models, running on the same distributed infrastructure, can estimate the probability of a measles flare-up based on current gaps, giving policymakers a data-driven basis for tightening school entry requirements or allocating funding for outreach. All of this happens without a single central authority curating the data, making the insights both faster and more democratic. Of course, turning that vision into reality isn't as simple as plugging in a few computers. The biggest hurdle is data standardization. Immunization records today are stored in a patchwork of formats. Some states use HL7, others rely on custom CSV exports, so a common schema must be agreed upon before the network can speak a single language. Governance is another critical piece. Who gets to feed data into the system, who can query the results, and how do we verify that the outputs are accurate? Finally, trust remains a cornerstone. Public health agencies must be convinced that a distributed network can meet stringent regulatory requirements like HIPAA and FERPA while still providing the transparency needed to rebuild public confidence. Overcoming these obstacles will require a coalition of technologists, epidemiologists, legal experts, and community leaders, a multidisciplinary effort that mirrors the collaborative response needed for any pandemic. When those challenges are met, the policy implications become profound. The rise in exemptions isn't just a statistic. It reflects shifting social dynamics, legislative relaxations, and targeted misinformation campaigns. States that have loosened non-medical exemption criteria are now watching their coverage erode, while those that have reinforced mandates tend to hold steady. With a decentralized analytics platform, lawmakers can run rapid what-if simulations to see how reinstating stricter exemption policies would affect future outbreak risk. That evidence can become the backbone of new legislation, moving the debate from ideology to data. On the community level, parents could log into an open dashboard that shows vaccination rates for their specific school district, accompanied by AI-generated explanations that translate the raw numbers into plain language. Health educators could pinpoint neighborhoods where exemption spikes are occurring and tailor outreach messages to address the specific myths driving those decisions. By turning abstract national percentages into concrete, localized insights, the narrative shifts from distant bureaucracy to shared community responsibility. Looking ahead, the blueprint for a data-first public health future is clear. First, we need a national data exchange standard that lets every immunization record speak the same language. Next, pilot deployments of chain mind nodes across a representative mix of states, urban, rural, high exemption, low exemption, will prove that the technology can scale and adapt. Open-source dashboards built on top of that network will surface real-time coverage, exemption trends, and risk forecasts for anyone to see. And finally, AI-generated explanations will bridge the gap between technical analysis and everyday understanding, empowering not just experts but every parent, teacher, and citizen to make informed decisions. The latest CDC figures are a stark reminder that our herd immunity is fragile, that exemption trends can tip the balance in a matter of weeks, and that a minimalist data release leaves us scrambling in the dark. Decentralized AI platforms like ChainMind provide a pragmatic, privacy-preserving pathway to turn raw numbers into swift, transparent action. In a world where a virus can cross continents in hours, our data infrastructure must be equally swift and open. The tools are already here. The next step is for the public health community, the tech community, and every concerned citizen to adopt them before the next wave of exemptions pushes us past the point of no return. If you believe that transparent, real-time data can save lives, if you want to see a future where every community has the tools to protect its children, then join us at ChainMind. Follow our work, spread the word, and become part of the network that turns data into decisive action. Together we can build a resilient, open, and community-centered vaccination ecosystem, because when the data works for us, the virus doesn't stand a chance.